According to the president of the Trinidad and Tobago Registered Nurses Association, there are deficiencies within the nursing profession that contribute to issues with the delivery of optimal health care throughout all regional health authorities. Nurses have come under the microscope recently with news that 11 babies died at the Port of Spain General Hospital due to a bacterial infection and the treatment of families by nurses. More in this report.
Or it is an overall systemic problem, nurses found guilty of not adhering to standards of care towards patients and families should be held accountable, says I.D. Stewart, president of the TTRNA.
And are reacting in a manner which is not acceptable by the profession and by the relatives. You really need to remove them, retrain them, and then bring them back in.
He calls on the government to act on an 11-year-old proposal to institute an accreditation council for nurses.
To oversee all of the healthcare institutions and prevent what transpired on those fateful days in April from ever happening again.
He also noted that nurses are not authorized to share medical information with family members. Instead, that responsibility belongs to the designated doctors.
It is not for nursing personnel not wanting to be trained, but the sheer capacity to train them is not there. And sadly, currently as we speak, there's no training school for NICU nurses, no training school for trauma nurses, dialysis nurses.
Meanwhile, Stewart pointed out that the health system is failing nurses by not providing avenues for specialized training.
It is not a sexy topic to say, I have enough nurses, I have hired more nurses. It's not really a sexy topic. You're not going to get much votes on that. But you would get votes if you open a new hospital. Never mind, you can't properly staff that hospital.
He stated that this has a negative impact on the quality of care being offered to the public. Along with shortages in staffing throughout all regional health authorities, Stewart condemned the government for failing to address these issues.
When you walk in to the emergency department in A&E, for instance, they have a much higher complement of staff per patient compared to what we have in Trinidad.
Despite these realities, Stewart praised the Tobago Regional Health Authority for ensuring institutions on the island are better staffed. Candice Jackson, Tobago Updates Television News.